The heart also needs constant supply of blood. Okay, this is mainly to give oxygen to the heart muscle. We'll talk more about that. And inside, when you see these muscles, okay, these are called as trabeculae carneae. Okay, and there are some elevated muscles which are attached to cord-like structures of the valves. Those are called as papillary muscles. Okay, the valve has gone here, can't see the valve, but there is a valve here which is attached to the papillary muscles by tendons called as chordae tendineae, okay, cords of tendon. And this thick muscle in between, which separates the two, is called as interventricular septum. Okay. So these are the two atria. These flap-like appendages are called as auricles. And what else? And there is a remnant. There's an opening between the two atria in embryonic stage, and at birth it's closed up, and that is called as fossa ovalis. Right here. This part here. Okay, that's called as fossa ovalis. Okay, fossa ovalis. All right, so that's about it. So if you look into figure, what figure is that? The next one. Right, figure F, 18.2, 18.5 F. Okay, so E and F, that is the inner parts of the heart. Okay, so that's also going to be there in the lab exam. All right, thank you. This is the superior vena cava. In the back, this is the inferior vena cava.
Oh my God, I'm sorry, I did the wrong thing. I was trying to record.
Oh, that's okay. So they'll be posting it on Facebook anyway, right? You guys will be posting. So whichever is the best one. Okay. So blood comes from the body, from the upper extremities through superior vena cava, lower extremities through inferior vena cava, and if you look inside this teardrop, that is a coronary sinus. Right? That's teardrop structure, that's the coronary sinus. Blood comes into the right atrium. From right atrium, it goes into the right ventricle. Right ventricle. This hole here is, it should have a tricuspid valve. It's gone now, and it is attached by ligaments to the wall of the ventricles. Okay, we will go over those structures. From here, it goes into the pulmonary trunk. You were asking about whether it is left or right, right? So you have one major artery that goes out to the lungs. That's called pulmonary trunk, and then that divides into two. One goes to the right, one goes to the left lung. Okay. So this is the pulmonary artery. From pulmonary artery, it goes to the lungs, gets oxygenated, comes to the left atrium. From left atrium, it goes to the left ventricle. Okay, and again we have the bicuspid valve here. It's gone here. Okay, and then from here, if you see here, that is the semilunar valve, aortic semilunar valve. This is the aorta, and there are three branches of aorta right as it is taking the arch. So this is called the aortic arch, and you have three branches going off. This one here is a common, okay, branch, aortic branch, which goes to the right side of the head and the right arm. Okay, this is called as brachial, meaning arm, cephalic. So this is brachiocephalic. This middle one is left common carotid, and this one is the left subclavian. Okay, this one will later break into the right carotid and right subclavian. Okay, so this one is a common branch for arm and the head. Okay, it's called brachial. Brachial means arm, cephalic. Okay, this is the left common carotid. This is the left subclavian. Okay, so once it goes, again